Dr. David Fabi here, orthopedic surgeon, hip and knee replacement specialist here in lovely San Diego. All right, so now we finished the joint replacement surgery here in the operating room. So follow me, let's talk recovery. So prime example here, we're in an outpatient surgery center, meaning patients are going home the same day. So that lends itself to recovery. Back in the past, patients after hip replacement or knee replacement would stay in the hospital anywhere from 3 to 5 days, sometimes even longer. But now these days, more and more, the hot topic is same-day discharge, hip and knee replacements. Of course, the patient has to have good health and they have to be the perfect candidate for that. Not everybody's a candidate for same-day discharge. But that kind of lends itself to how quickly our patients are recovering these days. I'll tell you with regards to hip replacement, I tell my patients all the time, the goal is when you come into my office at 2 weeks after the operation, you're walking in normally, no cane, no walker, already super happy with your surgery. Whereas back in the day, hip replacements would probably take maybe anywhere from 6 weeks to 3 months to start feeling that way. Now we've shortened that down significantly. It's about a week or two. I've had patients that have gone back to golf within a week. Of course, that's not everybody, but that just shows that it's possible. With regards to knee replacements, the recovery is a little longer. Back in the past, it used to be about 3 months, 6 months, sometimes even a year. Now, most of our recovery, the goal is to be within the first 2 weeks to 6 weeks. And that's not full recovery, but that's when you're off of pain medications, already feeling the benefits and loving the benefits of the knee replacement, feeling better than before the operation. So it's a lot less shorter, and it lends itself to the pain management that we're doing, also the implants of technology that we're using. So here's our recovery room. This is where the patients go, and we just did a patient about an hour or two ago, hip replacement, and he's going to be going home pretty soon. We're going to get up and going. So big part of that also is pain management. Okay, before we used to pump them up with IV pain medications. Now we've gone away from that. We're using a combination, what we call multimodal pain medication pathway that incorporates using an anti-inflammatory medication, using a medication that attacks nerve pain, as well as a narcotic pain medication as needed. But even these days, we're really starting to get those narcotic pain medications out of that pain regimen. And most importantly is mobility. The more that you move, the more that you get up quicker, the less pain that you'll have. So that's a big part of what we're doing in terms of pain management and why patients are progressing and recovering a lot quicker. So.